Hey everyone, welcome to another Power Monkey podcast. On today's episode, Chad and I interview Dr. Aaron Horshig. Aaron is a former Olympic weightlifting athlete who has transitioned into being a doctor of physical therapy. He is most well known for his Instagram page of Squat University, which has blown up over the last couple of years and now has 1.4 million followers. He puts out so much great content, it's really ridiculous. On top of that, he has a full-time job of being a PT, seeing clients 40 hours plus a week. It's really amazing to hear how he's able to split up his time putting out such great content. He's been working specifically with Chad on a lot of good content over the last couple of years as well. And we go into some of his books that he's put out recently, as well as one that's going to be coming out the upcoming year. Aaron is an incredible resource, has such great information, and aligns really well with the way that we think movement should be done. We hope you guys enjoy this podcast. It's a really great one in terms of good information and another great resource for you guys in terms of good movement. Enjoy.
Dr. Aaron, Squat University, man, we're so excited to have you. Thank you for joining us.
Hey, thank you so much for having me on. I really appreciate it.
Yeah, absolutely. So you and I get to talk quite often, usually over text and, some of the things that we're working on, stuff like that, but don't really get to hear your voice a whole lot other than the videos that I see from you.
Sure.
And definitely don't get to kind of talk face to face in this way. So I'm definitely looking forward to it. And, as much as we work together, there are some questions that I have for you that I don't know. And I'm sure Dave has a lot as well. But one of the things that I just can't get past, Aaron, is I'm just so amazed at the amount of content that you put out. And when I first asked you to join me on some of the projects that I'm working on, I'm so surprised that you were able to say yes with the amount of stuff that you do. And someone that puts out that much content, I just want to hear what is your mission and what is your why for doing all that?
Yeah, that's a great question. I think the reason I'm able to put out so information is because with Squat University, I'm truly able to live my why and live my passion. I know for sure if this was not 100% what I meant to do and the passion behind it was not there, there'd be no way I'd be able to have the energy day in and day out to do what I do. I mean, it's something that's always in the back of my mind. I'm constantly thinking about ways I can create new content, ways in which I can reach other people on different platforms. Obviously Instagram is the platform that blew up the most within the last 5 years, but I'm constantly trying to reach people in other ways because I know people don't always have Instagram. Some people enjoy listening to podcasts. Some people enjoy learning by reading blogs, which is something that you and I have been able to collaborate a lot on recently, which has been amazing. I think it really comes down to Squat University is 100% my passion. And the reason for that really stems back from myself as an athlete. As you know, Chad, I've been an Olympic weightlifter, I would say, since 2005. Growing up, I always played the traditional sports, baseball, football, basketball. And it wasn't until I got to college that I ended up sort of ending that traditional sports realm and entering into Olympic weightlifting. And I'd always done, clean and jerks, bench, squat, deadlift, sort of the bigger, faster, stronger combination growing up through high school. And actually was really put into a great situation in high school because I was able to train with a coach who had a great understanding of the Olympic lifts. I mean, there was 8 Eleiko barbells at our high school gym here in St. Louis, which you walk into any high school gym all throughout the world, you're not going to see that many Eleiko barbells. So the ability to sort of be introduced a little bit to it at a young age was great. Obviously I didn't start competing until college. So then when I got introduced to it fully, I was like, man, you're telling me you guys get to go to the gym every single day and just lift and then compete in that on the weekends? It's like, that sounds amazing. I was always that gym rat. So then my entire career was just put right into, instead of being on, the baseball field or the football field, it was in the gym. And I loved every minute of it. And just like any single athlete who's been in the gym, there wasn't a year that went by that I didn't sustain some sort of injury. I remember one time having this hip flexor injury that was killing me. And it was literally like I had to take a lacrosse ball and I was rolling it out every single set just to decrease my pain enough to do the next set. Or there was a time where my knee hurt so bad that I had to literally stop squatting for almost 2 months. I ended up getting an MRI and there was like a stress fracture reaction in the top of my tibia. So I had to take time off and let it heal. So my passion for lifting was always, coming up with also these injuries, sort of headbutting all the time.
Mm-hmm.
So that sort of led me down the path of wanting to also be a physical therapist, because in knowing how devastating and frustrating these injuries are, I also, on the other hand, found out how great it felt when someone was able to help you get back to doing what you love to do. When someone was saying, hey, just rolling that ball on your hip flexor, sure,
Mm-hmm.
decreases pain for a little bit, but it's not fixing the why behind your injury.
Right.
And then all of a sudden, after a couple of weeks, my hip doesn't hurt anymore. And now I'm back to performing pain-free. And how great that feels to get over that frustration, that devastation of lifting with injuries. So when I became a physical therapist, my goal was always to educate and see what could I do to make the greatest impact in the world. And I found that it was speaking to people in the same way that I wanted to be spoken to when I was a younger athlete, and saying, hey, here's these things that you can do to, yes, reach your full potential, because that's why we go in the gym. We want to lift big weights. We want to, get on the competition platform. We want to set records and continue seeing what our potential is. But we're always almost hampered by these small nagging injuries because we're human. We push our body to the max day in and day out, and we just need a little bit of guidance sometime. And unfortunately, in today's society, we're not given the best guidance. We're either told by the medical society that we, always live in, that injuries are something that you just need to, you're lifting too much, take this pain medication, take 2 weeks off, then come back to it. Or we're told, that the lifting that we're doing is way too heavy. You just need to stop lifting altogether. There's a lot of people that talk down to you, and they use these gigantic scientific words that we learn in physical therapy school, that you learn in medical school, but the average everyday athlete, they don't understand that. So I wanted to be able to take and blend, what I learned in physical therapy school and then growing up as a young clinician, and then pair it with my passion for weightlifting, and then deliver it to people in a way that they can understand, and they can become actionable. They could be empowered to know what they need to do to not only get out of pain, to move better, to lift with better technique, and to reach their ultimate performance potential. And that's really what Squat University has evolved into over these last 5 years. And it's something that I'm extremely passionate about, if you can't tell. It's something that I wake up every single day and I'm like, what next could I do? What can I help other people? And I continue to lift, even though I'm a full-time clinician. I see patients 40 hours a week still. I'm still training as much as possible, even though I'm not competing anymore. I hung up, I guess, the weightlifting shoes after 11 years of competing. I'm still training constantly, and I'm still having, small aches and pains. And so everything that I talk about are things that not only I help other people with as a physical therapist, but also things that I've experienced as well. So sort of that blend together is something that I'm constantly trying to mold into things that I can deliver to other people to really help them find the best situation in life when they enter the weight room.
I just had a quick question to go along with what Chad's initial comment was about, where does that passion come from to put it this much content? And you kind of answered a little bit with regards to your daily work. You're putting in 40 hours a week as DPT on top of being, so just prolific on social media. That can be a full-time job in and of itself.
100%.
Do you feel like the time that you spend with your private clients on a regular basis assists you in being able to put up content? Do you feel like it takes away from it? How do you merge those two worlds? Because you feel like it could work together, but 40 hours a week, full-time job on top of all of this, how do you find the time to balance all that?
That's a great question. The first thing first, people don't really realize that I'm still a full-time clinician. I've had so many people, they say, wait, you treat patients full-time? I'm like, yeah, I go into work every morning at 7:30. I see patients, get home late at night. It's not like Squat University is my full-time job. So really, in order to put out that much content, I don't waste any time. I have a guitar sitting in the side of my room. I haven't picked it up in 2 years. I've got a PlayStation in my basement. It's a PlayStation 3. I think I haven't, I don't even play it anymore. I haven't upgraded. I used to love gaming back when I was in college, play Call of Duty in between classes and stuff like that with your buddies. My literal passion is wake up, and it's Squat University, going to work. And then at the end of the day, when I'm coming home, it's, we put the stuff aside and it's time to spend time with my wife. And then we get up and we do it all over again. So it definitely is tough to find the time. But the biggest thing is, if it's truly your passion, if it's truly something that you love to do and you were put on this earth to do, it becomes easy to put away and put aside the things that often waste your time. Like think about how often people waste time just scrolling through Facebook,
Yeah.
you know, or scrolling through TikTok or whatever app they're using. You know, if truly something is your passion, it doesn't seem like a waste of time to do it. You're just constantly engaged all the time. Now, you asked about, you know, seeing patients 40 hours a week. I believe it actually is one of the best things for helping me create content because there's always something new. You know, a lot of times people get stuck in the hole when they're content creators. They feel like they're just doing the same things over and over again. They're saying the same thing. Now, while obviously there are some, you know, level of similarities between a lot of the things that you hear me say, technique is king over and over and over again. You know, I don't want to see how much you lift. I want to see how much you lift well. Things like that. You constantly hear this. But what happens is that when you're treating 40 hours a week, you're becoming a practitioner of what you're saying. In the same way, Chad still coaches athletes. You know, you're constantly talking with people. You're not just sitting behind the ivory tower telling people and preaching to them from what you once did. You're still engaging. You know, you're still constantly a practitioner, because the one thing I'll always tell people is that I don't have all the answers. I'm constantly learning myself. There's not a day that goes by that I'm not scrolling through research and trying to learn from other people, or listening to a podcast, or reading through someone else's book to try to really continue my own learning. I mean, I've only been a physical therapist now. I graduated with my doctorate in 2012. I mean, I've only been a physical therapist for so long. So I know that there's still much more to go. So being able to have patients in the physical therapy clinic 40 hours a week, I'm constantly able to try new things out, to test new things, to try, all right, I have this back pain patient. Well, let me try this new screen. Let me try this new way of tweaking our exercise regimen. Let's try this exercise I saw that's supposed to be helpful for proprioception and, you know, making sure that you can balance and be aware of core stability while not adding too much load. Like, let's still trial something like that out. And it's constantly, it's refreshing, and it keeps me on my toes. So I do enjoy it. It definitely is a tough thing to handle time-wise. You know, I know Dave Tilley obviously does sort of the same thing, but with the gymnastics world. And, you know, you hear his sort of schedule. It's a very similar thing. You know, it's constantly, there's no time wasted. There's a time for this, there's a time for that. And when you're doing this, you're always, I mean, in between patients, if I have 15 minutes, I've got notes done, I'm not relaxing, sitting back, scrolling through Facebook. I'm already getting ready for my next post, or I'm messaging someone back. I'm constantly doing something because it's my passion. I love doing it.
Yeah, to say that you're doing an incredible job is an incredible understatement. I mean, not only you're putting out a lot of content, but it's really good, useful content. Like you said before, you're not speaking to people in big terms that you learned in college. You're speaking in a language that they can understand, simplifying things for them, and it's easily applicable. And that's, you know, what I like about it so much. And some of that content that you've created have been in the form of, you have one book out and you're getting ready to put out your second book. So tell us a little bit about that, you know, just a brief description of what the first one was and how the second one's going to be a little bit different.
So the first book was something that I worked on for a number of years called the Squat Bible. And here's the reality behind how that came to be. Early as a clinician, during the time in which I would do an evaluation on a new patient, and this could be anyone. This could be, you know, a high school player, basketball player with knee pain, could be a power lifter with back pain, you know, across the spectrum. What I do during the evaluation is basically have to be a detective to figure out what's going on, what caused this person's pain. And during our evaluation, I would ask them to perform some basic movements, a squat and a single leg squat. And in doing that, it was like this deja vu like scenario. Time and time again, I was seeing these great athletes, especially many that are pushing big weight in the weight room with a squat, not be able to take their shoes off and perform a great looking ass to grass full depth squat. Needless to say, there's no way they could do a single leg squat. And it sort of dawned on me that as a society, we've conceptually rearranged our athletic priorities to think that the squat is first and foremost an exercise. We sort of forget about the movement of it. We think that because we can squat big weight, that the movement of the squat will suffice. That I don't necessarily need to be able to sit down into a bodyweight squat for 3 minutes. Who needs to do that? I'm trying to squat 600 pounds. And I think because of that, that we have sort of put more emphasis in the strength, in the skill of moving big weight, that we've negated the fundamentals of mobility, stability, and movement quality. And there was a quote by Louis Simmons that said, a pyramid can only be as tall as it is wide. And if you look at the way an athlete should be built, their ability to move well, their movement quality sets the foundation for their own pyramid. So my goal as a clinician, as a weightlifting coach, as someone that's trying to teach the world, is say, hey, let's flip back over your pyramid that's been flipped upside down. And let me tell you how you can, improve your fundamental base movement. Let me tell you how you can squat well, so that then you can reach your potential of what you're, possibly capable of doing. Let me help you live pain-free and squat big weight. And I felt like the squat was sort of that cornerstone fundamental movement that most of us have lost. Mm-hmm. So the squat Bible basically broke it down. Here's proper technique with a bodyweight squat, with a back squat, with a front squat, with an overhead squat. Here is how to find if you have a problem with your technique. How do you know? Use a simple thing called the joint by joint approach. And you break down the body based on these categories of what your body should be able to have as a role in that area. You should have stable feet. You should have mobile ankles. You should have stable knees, mobile hips, stable back, basically success all the way up. So it allows you to have some simple screens that you can do at home. You don't have to go to a doctor. You don't have to go to a physical therapist. Here's a way in which you can test your ankle mobility at home. If you have a problem, here's how you can fix it with a couple exercises, and how that helps you improve your quality of technique, which then sets you up to lift big weight. So it wasn't a very long book. I think it's about 128 pages, but it was one sort of the fundamental thing that I wanted to put out there first to help any single person out there who's going to squat, which is literally every single athlete. Mm-hmm. Now, after that, I really started diving into producing a lot of content that talked about injuries. So I guess if you would say the squat Bible is sort of the precursor, like do this and you won't get injured as often. Mm-hmm. The second book says, all right, you're injured. What do you do? Now, in today's world, like I said, we sort of run into a wall, and athletes are either faced with a couple different options. The first option is the way we're told on TV, right? Leave it, right? That's the thing that everyone says on TV. Take some Tylenol, 8 hours of relief so you can get on with your weekend. So we're told to take these medications and just cover up the pain. Option two, they go to a medical doctor. First off, they have to wait probably 2 weeks just to get into their doctor. Their doctor doesn't understand lifting, pushing big weight, or the desire to do that. And they say, hey, just take 2 weeks off lifting, take this medication, get the inflammation down, and then slowly return to it if you want, or just stop altogether. Heavy deadlifts are horrible for your back. Heavy squats all the way to full depth, horrible for your knees. So you get bad advice that way. Or maybe you go to a rehab professional, chiropractor, physical therapist, but they don't understand lifting as well. And while they may decrease your pain in the short term, they don't actually address why the injury is there in the first place. They don't actually help fix the why, which is often related to poor movement and or the training loads that are imposed in your lifting. So my goal is to say, hey, every single athlete out there, you deserve the right to be able to take the first crack at fixing your pain. But the thing is, today we don't have the information to understand how to do that. So I wanted to create basically a combination of all the work that I do as a physical therapist, simplify it in a package that I can deliver to you. So as an athlete, you're lifting big weight, you got sets of 10 this week, back squat, you're starting a new sort of hypertrophy block, and your back just is on fire the next day. What do you do? Well, instead of turning to one of those routes that has not been helpful for you in the past, you open up the book, you go to the back chapter, and you read about how back injury starts. You understand and you learn the injury, about why it even started in the first place, knowing that it's there for a reason. You take these simple tests, things that you can do at home. Some of them you may need a friend to move your leg around, but other than that, you can do them all on your own. And then based on what you find, there's individual progressions for what you need to do to take the first steps to decreasing your pain and getting back to lifting pain-free. So I know how frustrating it is as an athlete to be hampered down with injury, because I've had them all. And I wanted to create a book that could be the first step for any single athlete to take better control of their lifting experience, because there's not a single athlete out there that goes through any sport for any length of time completely pain-free. We're always dealing with small aches and pains. And I think we should have the empowerment to know what to do in that first step. And that's sort of where the book, it's called Rebuilding Milo. So if anyone listening probably knows the story of Milo, he was one of the greatest Greek Olympians to ever live in wrestling. And his story was that as a young boy, he would lift a calf to his shoulders every single day. And as the calf grew in size, so did his strength, to the point where he was hoisting a massive bull on the top of his shoulders. And I think if you actually read into the story, I think he like walked all the way down to the Olympic Stadium, walked around the stadium with this 900-pound bull, and then like killed it and ate it in front of everyone. I think that's the story how it goes. But basically the theme behind Milo was that it sort of set the stage for progressive training, progressive overload. And that sort of sets the theme for just modern periodization as a whole. Well, the idea behind periodization is that your body adheres to this scientific code, in that we apply a load, and if the load isn't too great to overcome our current capacity, we rest a little bit, our body adapts, and it gains strength. It gains aerobic capacity. It gains whatever we're trying to, build back up, maybe muscle size, muscle strength. But there's this code. Well, unfortunately, as athletes, we're constantly disobeying this code. You think, a set of 10 sounds great. What about 10 sets of 10? When your capacity is only 6 sets of 10. So that next day you wake up and, oh, your back's hurting so bad. We're constantly sort of playing around, because training is not just science. It's also an art, and everyone's a little bit different. I mean, this, Chad, from weightlifting, you can't give the exact same training plan to 10 different athletes and expect the exact same outcome in all of them. Everyone's got their own history of injuries, or lever lengths, or, different capacities to clean versus snatch. So you really have to individualize training programs if you want the greatest outcome. So as athletes, we're constantly sort of messing around with this art versus science and constantly disobeying this code. Well, if it happens to a small degree, you wake up and you're a little sore and you go on with your day. But if it happens longer and longer in the sport of weightlifting, powerlifting, and CrossFit, we don't see these acute injuries like a torn ACL in football. We see these chronic injuries that sort of, one day my elbow's a little sore, and then I keep on training with it and I forget about it. And, eventually it becomes to where every single lift, my elbow's hurting. Well, there's a reason for that. So the goal with Rebuilding Milo is to help you understand what is that reason. Here's some simple screens that you can break down your body and understand the why behind your injury, so you can take the first steps at tackling it and get your body back in that natural equilibrium that allows you to train, stress, adapt, and get stronger and perform to your greatest potential.
This is a really fine line, though, right? Between understanding what pain is versus what understanding as an athlete, as an individual, understanding what an ache and pain is, or like just aches, and like say, okay, I can actually push through this. I shouldn't take that doctor recommendation of taking 2 weeks off, because that's not going to benefit me. Versus this is actually painful. I should actually back away. I should look at some correctives. I should look at bettering my technique versus putting on, more weight than I did previously. And in a lot of ways, that's an athlete understanding what their limitations are and what their starting point is, right? I mean, it's so difficult for you to put out a post, or for us to make a general recommendation to everyone and say this is going to be a one-size-fits-all situation. But a lot of times what I'm hearing, especially from PTs these days, is not the recommendation of it's hurting, let's back away, let's take time off. It's let's figure out the source of the injury, let's push where we can, let's continue to make strides in certain areas. Whereas, pain versus discomfort, that needs to be kind of distinguished between those two. Is that a fair assessment?
For sure. And I think the more seasoned you are as an athlete, the more you understand.
Yeah.
This is something that it's achy, but I'm okay to push through because I've experienced this before. And then, this is not good. And an easy way to understand for some people that are newer athletes is that pain, real pain that is an injury, does not get better with more load. And it actually will probably get worse. Soreness and discomfort is a normal part of being a strength athlete. You will be sore. You will be uncomfortable. You're pushing your body day in and day out, big weights. You're not going to feel great all the time. In fact, if you're feeling great all the time, you're probably not stressing yourself enough. Right. But the thing is that when you warm up well, the discomfort sort of goes away. That's the big thing, is that when you warm up well, your body feels better and you're able to move a little bit better. It doesn't feel that way if it's an actual injury. So that's the first thing. And the reason it's so important to understand the difference is because pain changes the way you move. Pain will actually turn certain muscles off. It changes firing patterns. It changes stability that certain muscles are providing. So it's going to affect, especially for Olympic lifting, technique is everything. If you're off by a centimeter, it's going to affect the entire lift. Pain changes coordination. It changes technique. Same thing for being a gymnast. I'm sure technique is everything. So if you're off by just a little bit, it's going to affect your entire pattern of what you're trying to do. So that's why it's so important to not just continue to push through it. Now, the big thing, like you brought up, I'm a huge advocate of train what you can train while you fix what you can fix. So for example, for a weightlifter that comes in and their shoulder is just on fire and it's not feeling good at all. So jerks that day, we can't do jerks. Well, let's do some corrective exercises. First, let's figure out why it's there. Let's understand and address that shoulder. But does that just mean we just stop training that day? No. We do, all right, well, maybe let's go a little bit heavier with your cleans today. Or let's do something else. Bend over row. That's obviously still an upper body movement. Can you train bend over rows today? And that's where having the coach, and oftentimes if we're dealing with a bigger team, they're going to have those collaborations between the coach, the physical therapist, the athletic trainer. There's a lot of people that are collaborating together so we can have the greatest outcomes. But it's always, train what we can train while we fix what we can fix. Another great example is back pain. Back pain limits so many people from doing anything. But a great way that you can continue training your athleticism and your strength for a lot of people who have back pain is using something like a belt squat machine. If anyone follows Blaine Sumner, he's a huge power lifter. He's dealt with a lot of back issues over his career. Loading the bar on his back, no matter what type of load it is, whether it's using like a safety squat bar or back squat, it's just way too much for him sometimes. So he is able to continue building his strength or maintaining his strength and athleticism with a belt squat machine because of the way I use the Squat Max MD, the way in which the weight is hung between the legs and not pulling forward, it's completely limiting or at least greatly reducing the amount of shear force placed on the low back. So for certain people, it allows them to still squat with weight hanging between their legs rather than maintain that bar on their back. So again, it's something that takes the collaboration from different coaches and different practitioners. But the first thing first is understanding, is this pain that is hurting me and is getting worse the more I lift? Or is it something that I'm just achy, I'm sore because of, my training, but if I warm up well, it's feeling better. Okay, now I can push.
Yeah, I think that's such an important distinction. And Chad, I'll let you get to it in a second. But just for listeners out there, because I find myself doing the same thing. And I mean, I am a seasoned athlete. I have gone through my own fair share of aches, discomfort versus actual pain. And I know when to push, when to back off. But for the everyday athlete just going in, training, 4 days a week or 3 days a week doing CrossFit, they don't have a DPT that's overseeing what they're doing. A good way to kind of monitor it is, let's warm up. Let's go through the progressions. Let's see how you're feeling once your body is at your core temperature is raised. Do you move better now? Does this pain subside? Do you feel like the joints are kind of moving a little bit more freely now? Can you get through the workout? And then later on, maybe the pain comes back in once you've cooled back down a little bit. The discomfort kind of sets back in. But that's a good indicator that users can kind of use as a starting point as to something can use personally.
Yeah, the warm-up is key. That's one thing that I think too many people underestimate today. They walk into the weight room, they take a scoop or two of pre-workout, and they grab the bar.
Sure.
I mean, Chad and I have put out so much content on the Olympic lifting progressions and showing, hey, here's how you warm up. And, just last week, I put out something with Chad's amazing videos of him squatting, doing a progression barefoot and then grabbing the bar and then grabbing, I think it was 60 kilos or something like that. It's slow. It's got to be that way because you need to acclimate your body to what you're trying to do that day. If your warm up for squatting is walking into the gym and grabbing the barbell and doing some squats, you're not preparing your body adequately for the task at hand. And yes, you can get away with that for a while when you're younger, but over time, things are not going to work out well.
Yeah, I'm just kind of laughing in my own head over here because it certainly wasn't always that way, Aaron. As you mentioned, when I was younger, I was never really terrible about, jumping into heavyweight really quickly, but it was, usually just 5 or 6 leg swings and grab the bar and start snatching, or, do one set with the bar of back squats and then start throwing weight on there. But, I wish, knowing what I know now, I would have spent more time, not a lot of time. I mean, I even tell people to this day that have a decent amount of limitation and change that they need to make in their body, 15 minutes of warm up, if you're doing the right stuff for you as an individual, is enough, and probably I would dare to say optimal, and maybe we can talk about that a little bit more later, Aaron. But what I want to ask you before we get too far off the topic of injury, being that that's what your this next book is about, what of all the stuff that you wrote and that you talk about and that you work with people on, what are a few of the most common injuries that you find with your patients that come in the clinic or people that message you? And what are the most common go-tos for those injuries that are low-hanging fruit that you go to initially and they'll fix most people?
Yeah. So let's say that the two most common areas of injury that I see is probably low back and knee pain. Now, let's talk about knee pain first, because almost every single athlete that walks into a weight room has had knee pain before. Most people will say that their knee pain is patellar tendonitis,
right?
Because they have pain around their patellar tendon. And that's often not the case. Tendinopathy is a specific pathology, a specific injury to the tendon itself, and often where the tendon connects to the bone at either the tibia or where it connects to your actual kneecap, your patella. And there's a couple different tests that you can do, but most of the time, those people that are having actual patellar tendinopathy are not often weightlifters or powerlifters. Often they're volleyball players, they're basketball players, they're runners, people that are doing a lot of constant pounding and using their tendon as a spring. Now, weightlifters, obviously, because of the quick bounce that we get a lot of times at the bottom, can have this issue. But here's the big thing that often comes into play is tendinopathy, first off, is load related. So if you're sitting around at night watching TV and your tendon hurts, probably not tendinopathy. The pain is probably referred from the kneecap, in an area around the kneecap. The second thing is that patellar tendinopathy is very specific to one area. So if you have pain that feels like it's sort of on the inside part of your kneecap one day, maybe at the bottom, maybe like right underneath the kneecap the other day, sort of moves around a little bit. It's not pinpoint to one specific location. While you're doing movements, things like that, it's probably not tendinopathy as well. And the reason that's so important to distinguish is because tendinopathy has a very different type of approach for fixing than most common causes of knee pain. Now, most common causes of knee pain, I would classify as a biomechanical dysfunction, which is a complicated way of saying you're moving poorly. Now, that could be broken down into different subcategories of stability deficits or mobility deficits. And you can definitely have both. So mobility deficits. If you have an ankle range of motion restriction, so you have mobility problems at the ankle, or you have a mobility problem at your hip, or you could even have both. Stability issue, your knees are just wobbling around too much. Both of those things combined or by themselves create an issue at the knee, similar to if you were to open a door, but instead of just opening it straight, you're pulling up on the hinge. There's uneven forces at that hinge joint. That hinge joint is meant to open slowly back and forth in one plane of motion. Well, what happens is that if you pull up on that doorknob really hard and yank on that handle, all of a sudden that joint, the hinge joint between the door and the door frame, is having uneven forces placed on it. Now, yes, if you look at your knee joint, there's a couple different things that are occurring. It's not just opening and closing, but there's a little bit of rotation as well. But for the most part, a knee is basically like a hinge joint. And if we have a lot of uneven forces placed on it, it's going to eventually become cranky. So that usually is the number one cause for issues at the knees. We have mobility issues or stability issues, or we have to understand what that is, because you can't have that one-size-fits-all approach. But like you said, what are some common things that can be helpful? For knee pain, a single leg squat. It's very, very simple. The large majority of athletes that come to me, and I'm doing our evaluation, like I said, I ask them to get out of their shoes and do a double leg squat. Okay, I've done that before. I'll squat down. Looks okay, maybe. Sometimes, people are shifting and stuff like that. But then I say, do a single leg squat for me. And first off, people are like, you mean like a pistol squat?
Mhm.
Because really, besides CrossFitters, not many people are having pistols in their program.
Right.
Now, while I don't think that every single person should be able to perform a full depth pistol squat, you should be able to control a good single leg squat to probably at least parallel, if not a little bit past. And the inability to do that shows you have a problem in control or mobility, your ability to use and control your body through a specific range of motion. So training a single leg squat with, I have a touchdown progression that I love to use for people, where we start on like a small height box or a plate, and you're just learning the basics of a hip hinge and then knee control. And then as you get better quality of movement, you go deeper and you're able to expose your body to controlling yourself through a full range of motion. I think that's one of the things that can just sort of like, it's a catch-all. It's something that's almost in every single program for knee pain issues. It's because people completely forget that a single leg squat is something they should be capable of. So when they're able to actually regain that ability, a lot of things take care of themselves. So that's number one, is knee pain. The second one is back pain. Now, obviously back pain can be very, very multifactorial. There's so many different issues. I actually just put up a post today that it's an older sort of one that I made with Dave Tilley and some of his gymnasts on extension-based injuries. And extension-based injuries can be common in both Olympic weightlifting and especially in gymnastics. Now, obviously, they're very different as far as gymnastics is much more movement into hyperextension, whereas weightlifting is much more slight extension with a lot of load. But for the far majority of people coming into a weight room, we often find that flexion-based issues arise as the most common cause for low back pain. And that would be often like a disc injury, so often the pathoanatomical, so the actual anatomical cause for the pain. Now, a flexion-based injury occurs because the person does not move about their hips when they're lifting for the large part and allows their back to round. So they have a poor ability to brace and lock their spine in place and then move about the hips. So if we look at a deadlift or a clean, they often get into a good start position, but as soon as that bar is pulled from the ground, the spine moves. There's not necessarily a huge problem if the spine is locked in a slight rounded position and then move about the hips, but it's the movement that often is the factor that eventually predisposes a person for an injury. And again, this isn't something that all of a sudden just once, is a huge injury like a torn ACL. It's cumulative over time. There's a lot of research in these biomechanical models where they are able to take spines of identical spines, like 50 of them in a row, where they all look the exact same. They expose them to different repetitions and different amounts of load. And they find that time and time again, it's the combination of load and movement that eventually leads the spine to actually break down. So again, this isn't something that's going to start day one, but is over time, if you're lifting with poor mechanics and you're allowing your spine to move while you're lifting heavy weight, and the more movement and the more load, the quicker your spine eventually becomes injured. So one of the simple, most catch-all things that can go for almost any type of back pain is just learning how, when you're doing something where you're lifting heavy, is learning how to brace your core and then move about your hips, whether that's a squat, whether it's a clean or a dynamic movement like the snatch. You want to be able to brace your core and move about your hips. So just breathing and bracing is really key. Learning how to hip hinge. And then for a corrective exercise, I love doing things that sort of prime our bodies to learn how to brace before we get under the barbell. I love the McGill Big Three for that, just because it hits all parts of the spine. When we look at the spine, sometimes you'll hear people say, oh, the transverse abdominis, that's the most important muscle of the core, or the QL, that's the most important muscle of the core, when really it's taking sort of a very microscopic view of what the muscles that surround the spine do. It is actually, if we take a step back, it's every single muscle that surrounds the spine that has to play their part, similar to every single musician within a symphony orchestra, have to all play together for harmonious music to occur. Well, in the same sense, all the different muscles that surround the spine have their job to do to be able to create harmonious motion, which is keeping the spine from moving while the body moves about the hips. And depending on the task, these different parts of the body have to play a little bit different. So in a deadlift, the muscles that are engaging at the very bottom of the lift are going to be a little bit different than the muscles at the very top of the lift. So our body's constantly changing. Hey, this muscle, you need to pick it up. This muscle, turn off just a little bit, so that we have this co-contraction, but perfect harmony between all the muscles, so that, again, that spine doesn't waver and doesn't move, but stays stiff and then is moved about the hip joint. And that's usually one of the things that can be a catch-all fix for a lot of back issues, either before they occur or during the rehab process.
Awesome. Awesome. I wanted to go back to the knee real quick, because you mentioned one of the things you said is power lifters and Olympic lifters usually don't have a lot of knee pain. It's usually coming from some other sport. But I wanted to get your opinion on this, because I feel I had some what I call knee tendonitis, throughout my career when I was lifting heavy, doing 6 to 9 workouts a week. It was very regular in my right knee, specifically on the very tip of the top of the kneecap. And, I wish, knowing what I know now, like that was my gauge for volume. I feel like I should have said, when this is flaring up, especially when it's flaring up a lot, like more than regular, like that was my gauge where I should have went lighter for a day, and it would have made a huge difference in my training and I think my progress. But I feel like when weightlifters specifically have knee pain, especially a lot of knee pain, a few of the common reasons are volume, overall volume, because I feel like knees are a great gauge of volume, but also because they're inconsistent in the depth that they're squatting to. And so I think their knees hurt from squatting partial depth all the time, from changing direction from that partial range when they're upright and their knees are forward. And also they get kind of a double whammy put on them, because when they're not squatting to full range and preparing that bottom position that you mentioned we bounce against in the clean, where you're going to do that, when you don't prepare for that, when you're not doing pause squats and getting comfortable and getting strong standing up out of that bottom position with squats, but then you're using it in the clean and getting more of a stretch on your knee from that full range. Would you say that those two things are reasons why weightlifters could have knee pain?
Definitely. So let's take that first one, which is volume. Now, like I said before, the reason pain sets in with a lot of athletes is sort of twofold. It could be a technique issue or the amount of load. And it all comes down to a lifter's capacity. So if you have a very seasoned athlete, so let's say when you were training and, at your peak, the amount of times you could lift throughout the week and the amount of volume that you could lift was much greater than someone who's only been in the sport for 2 years. So the capacity level that you had built up was much higher. I almost think about it like a thermometer, and your thermometer rating was 95 degrees. Whereas you may have an athlete who's brand new to the sport and their thermometer is only reading at 60. So you have a certain level of capacity. Now, if you place a demand on someone in one workout or a span of workouts, that's, let's say, that 60-degree athlete, and you put a degree level on 70, you rose it higher than their ability, that is something that's going to spark injury. But you sitting at 95, you do that same 70-degree workout, it's well below your capacity. You're fine. So it's really understanding sort of where each individual athlete is at. And if you do more than what your body's capable of recovering from, like I meant, that scientific code, right? If you break and do more than your body's ability to adapt safely, eventually these chronic issues start breaking down and occurring. So that's definitely one thing is too much volume, and understanding when it's time to take a step back, understanding too that in doing so, you're not going to lose all your gains. That's a big thing mentally for a lot of people. Man, I've got my plan written out for an entire 12 weeks. And this week I have 8 sets of 2 at 85%, and I hurt. What do I do? And then all of a sudden you get anxious because you're like, well, I'm not going to feel good. But if I take a step back and do 75%, then I'm going to be off track. And then that next week when I go to 90, I'm not going to be prepared for 90. And then, you just start planning this whole thing out in your mind, because I've done the same thing, but understanding that it's not one day's workout that sets you up for that, ultimate progress. It's the culmination. And if you can take a step back in the short term and allow your body to heal up, you will be able to eventually far surpass what you're currently doing. But if you push through the pain, things are not going to end up well. And you may get by with it for a while, but eventually you keep on pushing through that small pain. Now, all of a sudden, that next week, it's a little bit more cranky. And the week after, that knee's a little bit more cranky. Now, all of a sudden, Instead of being able to lift 5 days a week, now you have to cut it down to 3 because you can't lift 5 days a week. Or you're finding yourself putting icy hot on your knees and covering it up with knee sleeves and doing ice after every single practice because your knee's hurting so bad you can't walk up and down the stairs. So it's this cumulative effect that we need to be able to understand that it could have just been halted by listening to our body in the first place. Now, the second one you said was halting a squat too soon. I think the beneficial thing that most people don't realize is that when you squat to full depth, now full depth, again, is going to be a little bit different for everyone based on their anatomy and what they're capable of doing under load. But when you squat to what depth your body's capable of doing, you have this wrapping effect where all the muscles and the fascia, everything sort of tightens up around the joint, and you get this almost elastic bounce, similar to a plyometric, not to as great of a degree, but you get this sort of assistance where we're storing energy in the tendons and everything's tightening up with the fascia that surrounds the joints, and it assists in getting out of the hole. But when you stop short of that, there's a lot of shear forces placed down in the knee and the very bottom of the squat. And I think long-term that can be something that eventually leads to issues as well. So understanding and moving through your full range of motion and having complete control of that range of motion, I think is very, very helpful.
Yeah, absolutely. I like to describe it as it's very much like, all the cleans that you ever do are heavy max power cleans. Power cleans are very jarring. You're stopping, you're putting the brakes on and the weight's landing on top of you. Yeah, we use power cleans occasionally in our programming for certain reasons, but you wouldn't want to do that all the time, right? So to me, it's very much the same as kind of changing direction over and over in an upright position in that squat.
Can I ask a quick question about the back injury?
Yeah.
Specifically as it pertains to some gymnastic stuff, specifically with back flexion.
Yeah.
You mentioned that, most back flexion injuries coming from, you did a post today on extension injuries, things like that. But we've had a lot of questions on the gymnastic side coming to us with regards to back flexion. And with gymnastics, we call it compression, essentially, being able to bring the body down from the torso into the legs. We use it for a variety of exercises, whether it regards to, we call it a pike or a stoop through or stalled, or these movements that are a little bit more complex in the gymnastics world. You may have seen them with some interaction with Tilly. Mm-hmm. But I'm curious what your thoughts are on that range of motion that's necessary for a gymnastics perspective, or if you're working towards a skill and working towards an end result that requires you to be put into a very compressed position where your body, legs and torso are basically fully compressed on top of each other, and incorporating exercises that kind of slowly build towards being able to have that kind of back flexion. What are your thoughts on incorporating exercises and movements that allow to slowly build towards that? Or is it basically just not necessary or advantageous at all to be putting your body in that type of extreme back flexion, essentially? Because I've heard kind of various thoughts on this. I always kind of work towards the mentality of, if you're a gymnast, if you're working towards a movement that requires you to be in that position, then you should be able to train towards it slowly, incrementally over time. But again, it seems like a lot of the science behind it saying your back should not move in that particular direction. So I'm kind of curious what your thought process is.
I will say it always depends on the sport and the person. Now, I will say this, when it comes to gymnastics, and I know, from a high level elite athlete gymnast perspective, there's a certain body type that becomes sort of that higher level gymnast versus the power lifter or weightlifter, as far as they have the ability to be very movable, very mobile, very bendy. You often don't see a big power lifter excel in gymnastics because they just have that innate flexibility limitation, as far as their body was meant to handle a lot of weight, and you have the gymnast, their body was meant to bend and be able to put into a lot of different positions like that. When you actually look at the architecture of some of the spines, and I've seen some studies before where they looked at some elite level gymnasts, and the facet joints were actually angled a little bit differently in some very elite gymnasts than some elite powerlifters, I believe, showing that those who probably make it to the elite level sort of are predisposed to having inherently this type of genetic makeup. in the same way that, you know, if someone's going to be extremely good at powerlifting or weightlifting, they're often able to set their butt on their heels. They have very, very shallow hip sockets often. And there's an interesting study that was looking at inherently hip socket depth, that as far as different populations around the world, and they found that those who were from more the Eastern Bloc, Russia, Ukraine, areas like that of the world, that they had some of the most shallow hip sockets, more dysplastic hip sockets, rather than those who were in like Ireland. And if you think about some of the best weightlifters in the world, where they usually come from, you know, as far as the ability to be a gymnast, I think there's probably some genetic interplay as far as allowing you to get into a lot of those flex positions. The one interesting thing about gymnastics is that getting into those positions, you're under very low load. It's usually just body weight. And for that reason, I think if you are trying to get into some of those technical positions, you know, working towards those end ranges progressively over time, I think that's something that the body can adapt. And those that make it to the elite level, their body is designed to be able to withstand those forces to be in those positions safely. The one thing I think you get an issue with is when you try to blend extreme back flexion with loading. And I've seen some people, and they'll use like the Jefferson curl, for example.
Yeah, that one gets brought up quite a bit.
Yeah, and here's the funny thing with that is I remember hearing people say, and this is from the world of gymnastics, and I don't know about you, Dave, but when I talk to Tilly goes, I've never seen that exercise before.
Yeah, and I talked to Tilly specifically about it too, but
yeah.
The thing, I just, because this specific exercise, this specific topic is just something that comes up quite a bit. But when you talk about lack of load, maybe there's not additional weight being forcing an athlete into that position, but the amount of torque and forces that are being put on when you're dropping in from like, you know, a high bar movement or a girl's bar movement or a parallel bar movement, the amount of forces that are being generated dropping into the positions are extraordinary. Definitely. So, I mean, you're getting compressed at a really high rate. It's not a static position.
For sure. And especially all the landing that you're doing in gymnastics, like that's a lot of load very quickly too. So I think you have sort of two things at play is, yes, it's not slow load, but it is fast dynamic load.
Yeah.
So I think the core stability emphasis for a gymnast in whatever position they are in is very key as well. And then also understanding that some people probably will not have spines that can withstand that much motion.
Right. And I think a little bit of that is, it seems like a nature-nurture conversation. You're saying that some of those athletes are just predisposed to excelling in that particular sport because of their genetics. But it seems like a portion of it could be that gymnasts starting at 3 years old and go through their developmental stages doing a lot of these exercises have an adaptation that happens within their musculature and maybe within their skeletal structure even to allow for them to be able to go through these actions as they go through puberty, as they go through the developmental stages. They are prepared more for those exercises because they start at such a young age.
I would 100%. Yes.
Okay.
I would 100% agree with that. I think it's the adaptation, especially the younger you are, the sooner your body or the more your body is able to adapt to those forces, which is why you don't see someone pick up gymnastics at 18 years old.
Right.
You know, and often you don't see an Olympic weightlifter excel to the Olympics by starting at 25.
Yeah.
Can it happen? Sure. But
yeah, I just love having these conversations because the world that we live in is working with athletes who are older in age, who didn't grow up with these sports. So we're trying to give recommendations around, you know, what we're comfortable with that we knew growing up with. And now we're saying, how do we apply to these same techniques and movements? We want you to get this particular skill, but we have to achieve it through a different methodology versus what we maybe applied starting from 3 years old or 5 years old. So the end result is the same, but the route to get there is going to be different.
And and that again is where the art comes in of coaching. For example, you know, I know Chad knows a lot of weightlifters that excel. You start very young. I mean, you're grabbing a barbell when you're 6, 8, 12 years old, and you're learning, and you have the mobility, and then you're slowly learning technique. And then you're progressing as you get older. And simple things like sitting in an overhead squat with an open barbell, you do that for 10 minutes. It's simple.
Mhm.
You just sit down there, you're fine. Well, I'm working today with a gentleman who's, I believe, in his early 40s, CrossFitter, and he's having issues with his shoulder pain. And he's talking about doing snatches and overhead squats or something that's tough for him. And me giving him an open barbell, just without shoes on, he could not even squat to close to parallel. But he's going through and doing the Olympic movements. So my recommendations for him have to be very different to allow him, because I'm not going to tell him, don't do any Olympic weightlifting ever, because
Right.
that's what he loves to do. He wants to go to his CrossFit class. He wants to do an Olympic lifting. But the way in which we have to go about training the Olympic lifts and the recommendations for warm up and cool down have to be very different, because he has a totally different body. He has a totally different preconceived notion of what's possible. He can't sit without weight. He can't sit his butt on his heels. In the same sense, you could have someone that's wanting to do a specific gymnastic skill, yet they are 25 years old and maybe they're a fairly good athlete, but they're not the 13-year-old female who you could bend in a pretzel because their back is just that mobile. So the same recommendation for getting into extreme flexion may be very different for each person, because you're coming from totally different patterns. That one exercise or progression of exercise that works for the young gymnast to get into that extreme flexion compression may be fine for her. But you say that same progression and exercise for the 25-year-old, that's still a good athlete. It could create injury. It could be something that leads to pushing their body to the brink of injury. So it's very different. And it all comes down to that simple answer of, it depends. And that's why you can't just have that simple, do you have this injury? Do this exercise. You have to have context, and we have to have more of a conversation to understand the complexity, which is injury and injury mechanisms.
Yeah, in that regard, though, of course, you and I do this all the time, Aaron. We've been writing so much about assessing and addressing the issues on an individual basis, but I also think there are those, common exercises that everyone can do sometimes. Like, one of the things that I do every day as a warm up are cat cows. I'm 40 years old and I've been Olympic lifting for over 20 years, and I'm doing this basic exercise of cat cows to warm up. I'm doing 10, 20 reps, whatever it is. It's not a lot of reps, but I'm holding those extreme positions. And I think that's something that everyone can and should do on a daily basis. Would you guys agree with that?
100%. Yeah. I think it's, and again, talking about the spine, it's not that spinal movements are bad. A cat cow, you're moving extreme flexion, extreme, extension. It's not bad at all. But that same weightlifter, if you were to let your back round like that, picking up a deadlift, now we're talking something else. So understanding the complexities of the spine, but just simple hygiene, simple movements. We talk about hygiene for the rest of your body, but we don't talk about spinal hygiene or just, of your hips or your ankles and moving through full positions. These are things that you should have the potential to do the rest of your life. I made a post the other day, like, I'm going to be squatting a barbell ass to grass when I'm 85 years old. I hope everyone's there with me. And it's one of those things that, if you know what's important, which for us and the way we're talking, it's all, movement quality, and then being able to lift safely and move safely, whether that's gymnastics, Olympic weightlifting, powerlifting, CrossFit, you should be able to do that for the rest of your life if you're taking the right approach.
Yeah, you're preaching to the choir here. I mean, I don't know how much you know about Power Monkey in general, and like our methodology being based around technique and how much of an importance we put on that. But I can see why you and Chad have linked up with your stressing of ass to grass squats and Chad's just love of everything squat related. But actually, there's a question for you, Chad. I know that you guys have been working together a lot recently and putting out some incredible content, but I'm curious if you've learned anything specific that has changed the way that you approach your lifting, Chad, after having been to Olympic Games, one of the top lifters. Is there anything that's changed after working with Aaron recently as to how you approach your lifting now, or how you coach, or how you assess other people?
Oh yeah. I mean, that's a pretty easy answer for me. I mean, these are things that I think about all the time, and, I use on a daily basis. And every day I'm sitting down at the computer and, either writing something new on what we're working on, or going back and reading over something and editing, and then, using the information for athletes that I'm working with or myself. But, I do have some specific answers that I can give that I think will be beneficial for the listeners. But I mean, really, I've learned, a lot from Aaron in other ways, just in regards to writing and, creating content. He's helped me with a lot of stuff, but, specifically to movement, one of the things is that, I talked about some warm-ups that I do all the time. And one of the warm-ups along with those cat cows it's a squat sequence, and I have, individualized mobility in there for me. What's most important for me, one of those things, or my two areas that I work on, are my right ankle, because my right ankle is a lot tighter than my left ankle, and my internal hip rotation. It's not that it's like excessively tight, but it's one of the areas when I'm sitting a lot that will tighten up on me. So I'm always working on my right ankle and internal hip rotation. And I had known about banded ankle rocks for a while, and I'd done some before, and I noticed that they helped me. But we were writing on assessing and addressing bottom position mobility not too long ago, and his go-to was banded ankle rock. And so I'm like, okay, I've got to try this again and start doing it. So I've been applying that for about the last month or so, and I can absolutely tell a difference. And just to give some measurements on how much this helps me, whenever I do a regular ankle rock without a band, I can warm up well and I can create more range of motion. But when I test my ankle, so Aaron has a 5-inch wall test. And so you put your big toe 5 inches from the wall and you push your knee as far forward as you can. Ideally, you should be able to touch the wall. When I test my left leg, I can easily, comfortably touch the wall. When I test my right leg, when I'm cold, it's about 4 inches from the wall. So I can only get about an inch beyond my toe. That shows a very tight ankle. Now, when I do ankle rocks, regular ankle rocks, I can gain about an inch if I test it again. Banded ankle rocks usually give me 2 inches. So I can gain 2 extra inches, get 2 inches from the wall. So that does a lot for me in evening me out. So I'm a little bit upset with myself that I was so lazy with that for so long. A couple of the new ones, one is a hip airplane. So this is Aaron's go-to for internal hip rotation. And Aaron, here in a minute, I'll let you kind of explain that a little bit, because you have more experience with it, and even the banded ankle rock, if you want, just so folks will know how to apply that if they do have tight ankles. Mm-hmm. But the hip airplane, before I was just doing what I called internal hip pushes or a windshield wiper, which I still think is a good hip warm up. But this hip airplane, if I test my internal hip rotation after doing those, I'm just so much more comfortable in that test and my ability to rotate my hip inward. So that's my foot going out. It's a big difference for me between those two exercises. So, and I've been able to give that to some of my athletes as well to make a difference with them. One of the assessments and the drills that Aaron wrote in one of our recent blog posts was about tibial rotation. Now, tibial rotation, and Aaron, maybe you can touch on this a little bit too, but that is a big area for you to be able to squat deep and to do it well. If your tibial rotation is tight, you're going to have a tendency to turn your toes out a lot, and the knee is going to shoot to the inside of the toe. So it may not just be that you have a tight ankle, you may have tight tibial rotation. I actually learned that I have really good tibial rotation, and I think it made me realize that's probably what saved me all these years, because I'm able to squat deep with a straight foot and push my knee out sufficiently. I've got about 45 degrees of tibial rotation even on my right club foot, and it's about the same as the other one. We have said that sufficient is about 20 degrees. So if you're tight there, that's going to limit you a whole lot. And I remember, Aaron, actually after talking to you about this and going over it, I had a PT in one of my clinics probably 7 or 8 years ago that I was taking them through my own assessment. And he said, hey, all of your stuff I think is on point, but you need to add in tibial rotation. And he showed me briefly, and I was open to it. I heard what he was saying, but it didn't sink in at that point. But man, the athletes that I've tried it on here recently, and I've been able to recognize that their tibial rotation is tight and just give them the few simple drills that you recommended in the blog post, it's making a huge difference. So, I'm glad that you asked that, Dave, because I think those are three pretty important areas and drills that people can, one, assess to see if they have limitation there, and two, use those to address and make a big difference. And again, maybe not for everyone, but for most people, you're going to find benefit in those exercises.
Definitely. I mean, talking about that tibial rotation, that's just one that recently I've been really getting into. And again, nothing that I put out is brand new, the first time it's ever been talked about. I mean, I'm only standing on the shoulders of the giants who have come before me. But tibial rotation is, I think, one of the less understood topics of specific mobility limitations that hamper squat technique. And basically, the simplest explanation is that as you squat down, your tibia, your shin bone, it internally rotates and tilts to the side. So it allows someone to adopt a more forward foot position whenever they squat. And if you look at, any of your deep squats, Chad, I know a lot of people follow Max Lang, the German weightlifter, on Instagram. And Max has a really good, bottom position where his feet are relatively straightforward and his knees are out to the side. And in order to do that, you have to have this lateral tibia tilt, and then the tibia is actually internally rotate a little bit. Well, the biggest thing that I found is that if someone has an issue with like one toe spinning out to the side, or maybe their hips are shifting over one side versus the other, they've developed knee pain, you got to check tibial rotation. And oftentimes that can be something that's a little stiff on one side versus the other. So the drill that we shared can be, correcting forward almost 90% of the time. And I find that it's often connected with limited ankle mobility. And that if someone has ankle mobility limitations, don't just look at the ankle. Yes, those drills like the band and joint mobilizations can be very helpful, foam rolling, some stretching for the backside, but also look at tibial rotation because oftentimes they're connected.
Yeah. Where can somebody go ahead? Just go ahead, Chad. Just finding that exercise.
Right. And I'll touch on that, Dave. I was going to say, but I just wanted to add to that a little bit. Don't just chalk it up to anything. Don't just assume. And we just had Kelly Starrett on a few weeks ago, Aaron, who wrote the foreword for your book, right? So you're very familiar with Kelly, and you're a big fan of him as well. We're talking about straight feet in the squat and anatomy of the hips and stuff like that. And don't just chalk it up to it's the anatomy of my hips is this certain way, and you haven't even tested them. There's a good chance that you can't squat with your feet straight or straighter. And you can't get deep because of your ankle and or your tibia. There's all these things to consider, and anatomy is one of them. It's one of many things to consider. So let's look at everything and, get you an individualized plan. And Dave, to answer, I think what you were asking, I think in the description of this podcast, maybe we can put a link to a few of those specific blogs to where the listeners can see that bottom position mobility assessment. And then a few blogs down the road after that is a protocol that they can use to kind of input the information that they get for them on an individual basis to help them move forward and make the best change for them. And what is coming on top of that, just so this was a bottom position mobility assessment that we're talking about. We're also working on front rack and overhead, and going to be completely digging into the rest of the lift as we go.
I'm excited.
Yeah.
I can't believe we went through an hour already. That was stupidly fast. But again, when we have good conversations, it just lends itself to hopefully having you back on again, man.
Man, I'd be happy
if you're okay with that.
Yeah, for sure.
Before we get you off, though, we do have a couple of quick questions. Unfortunately, I think I know where this first one's going.
Well, you never know. You never know, Dave.
But a couple of quick questions to get you on board with we try to get the same question all of our guests with. But the first one is just, which sport do you prefer? Which sport or discipline, gymnastics or weightlifting? Can kind of move really quickly through this one.
It'd have to be weightlifting.
Yeah, fine. I'll give you that one, Chad.
He is Squat University, so you could do. He's big on body weight squats though, and pistols. So that's true. That's true. Gymnasticsy.
we don't have to sugarcoat anything. That was clearly a point for Chad. We've been keeping a tally on this.
I'm on a little streak here, Dave.
Yeah, you are. I don't know what the hell's going on here. It's pissing me off.
Pretty good. Who's our next guest, by the way? Maybe I need to keep this going.
We'll get Cheryl back on again.
I know,
I think she
right?
voted for gymnastics actually.
She did. Yeah, let's don't. Yeah, Service did as well. So.
Question number 2. Is there anybody that you would like to see on our podcast? Any guests you think we should have? Anybody that kind of comes to mind off the top of your head?
I think it'd be interesting for you guys to talk to Stuart McGill. I mean, as far as like the back
Oh, that would
questions
be
you have,
amazing.
Yeah.
I mean, Stu's awesome. So,
Yeah.
and a lot of the information that I have accumulated over the years as far as back injury, I mean, he's up there. He's the main guy.
Yeah, I've listened to so many of his conversations on this stuff. I would love to get him on too. So that's a good one to have on.
Definitely.
Oh yeah, that would be just about a dream come true for me right there. That'd be awesome. We need to give that a shot.
Mm-hmm.
All right, Aaron. So the last question, do you have a recommendation, or what is your number one recommendation for any of the following? Be a book, a movie, a documentary, a TV series, or a podcast, a specific episode on any of those.
Ooh, gotcha. So let's see here. Book for anyone that wants to continue learning. I love Back Mechanic. That's Stuart McGill's book that he wrote basically just on low back injuries, but he wrote it for, he calls it the layperson. I hate that term because it's the everyday athlete. Athlete. Back Mechanic. Let's see. What were the other ones? Podcast?
Well, no, just one of any of those, or if there's any of those other ones that stick out to you, documentary or podcast or anything like that you recommend.
Podcasts that I recommend. I'm trying to most of the podcasts that I listen to are like business related. I think I'd say. I'm huge for anyone that's interested in business related stuff. I'm a big fan of Gary Vaynerchuk, so any of his stuff is right up my alley.
Gary V grew up like 10 minutes from my house, so
no way.
Yeah, I'm a huge fan of his wine library stuff. He's from Springfield, man. So yeah, big fan.
I've never actually heard of him. I'm gonna have to look that up as well. All right. Well, Aaron, man, thank you again for coming on. It was an absolute pleasure. Yeah, we've been on here for 1 hour and 15 and it feels like 30 minutes. So I actually did have some other things that I wanted to talk to you about. So maybe one of these days we'll get you back on and we'll certainly look forward to that. Do you have any parting words for our listeners?
Oh my gosh. I just want to thank everyone that does follow Squat University out there. It really means a lot to me. And if anyone has any questions, definitely hit me up. I try to answer as many direct messages every single day and emails. I can only get to so many, but if anyone has any questions, definitely hit me up.
Yeah, I can't believe you're actually still offering that. That's amazing. And I know you do try to do that. And I did want to go back to the book real quick. I believe that's coming out in January. How can people keep up with that and check that out?
Yeah, so Rebuilding Milo will come out January 2021. It's currently available for pre-order on every single website. So Amazon obviously is the main one, but Barnes & Noble, a lot of independent booksellers should be able to also pick it up on their website as well if people order books through there. But yep, coming out January 2021. Very excited for everyone to have that.
Yeah, man. Well, I'm looking forward to that myself. Absolutely. And to our listeners, guys, be sure to head over to powermonkeyfitness.com for services and upcoming events. Also, keep checking out our Instagram pages for regular teaching and technical content at Power Monkey Fitness, at Dave Durante, and at Ollie Chad. On behalf of Power Monkey Fitness, we're your host. I'm Chad Vaughn with Dave Durante. And until next time, guys, thank you all for listening.